What's behind the United States nursing shortage? In recent years, healthcare systems across the United States have been grappling with the alarming nursing shortage. This shortage, while multifaceted, is notably exacerbated by the rising rates of stress and burnout among nurses. Nurses are integral to the healthcare delivery system, and their declining numbers pose a significant challenge to the industry. We're going to talk about all of that and more on today's episode of the Vibe with Kai podcast. How are stress and burnout impacting the nursing profession? Well, the demanding nature of the nursing profession often exposes nurses to high levels of stress. Long hours, emotional pain, emotional strain, and the physical demands of the job can all contribute to a sense of burnout. When unchecked, these factors can lead to a decreased job satisfaction and, in many cases, career attrition. Unfortunately, this cycle, it's been escalating. It's been getting worse, leading to an increasingly stressed and strained healthcare system. I hear all about it from my sister. She works for Johns Hopkins, and I hear about this every day. So, how does this relate to mental health? Well, the levels of stress and burnout experienced by many nurses can lead to serious mental health concerns. Anxiety, depression, and other mental health disorders are increasingly prevalent among nursing professionals. Indeed, the mental health of our nurses is as critical as the sustainability of our healthcare system as their physical health, making this a key issue that warrants our attention and action. So, what are the consequences of the nursing shortage? The effects of the nursing shortage, exacerbated by stress and burnout, ripple across the entire healthcare system. Increased nurse to patient ratios can lead to a compromised patient care and decreased ability to respond to emergencies. Moreover, the strain can on the remaining nursing staff, the people that are still there, can perpetuate the cycle of stress and burnout, leading to further attrition. What can be done? What can we do about this? Addressing the nursing shortage and the contributing factors of stress and burnout, it requires a multifaceted approach. First, improving working conditions and providing mental health support can help mitigate some of the stress and reduce burnout rates. Second, strategies to attract and retain nursing staff, such as competitive salaries and career development opportunities, that can be instrumental as well. And lastly, promoting nursing as a career and increasing the capacity of nursing schools can help to replenish the workforce. Now, it's not just limited to nurses, right? So I don't want us to sit here and think that, oh, this is just a nursing issue. No, this is affecting people all over the healthcare system. I remember reading a little while ago about how veterinarians are being affected by this as well. So it's not just about the nurses, but in this instance, we're talking specifically about the nurses because that's a very, very important, vital backbone to this entire healthcare system. But don't be fooled. This isn't just about the nurses. There's tons of people in the healthcare system that there are massive shortages because of stress and burnout. And you would think that we would put more emphasis into protecting these people, into giving them what they need, given how important they are to the overall health, literal health, physical and mental health of the people that they're helping. I mean, when we don't have these people taking in a condition to take care of the rest of the people out there, I mean, what do you think is going to happen? Like what are you expecting to happen if we do not take care of our medical professionals? What do you think is going to happen? There's three sets of people that I just don't understand how we just don't protect them at all costs, how we don't give them everything that they ask for. Number one, obviously, we're talking about people in the medical fields, right? I don't understand how we don't protect them. I don't understand how we don't protect teachers. A lot of our teachers are feeling stress and burnout as well. And lastly, the men and women that protect our country in the military. How are we not protecting these people at all costs? Why are we just overlooking their needs and overlooking the things that they're saying to us? It's not like they're silent. Like there are people that are speaking up and speaking out about this, but I feel like it's falling on deaf ears all the time. This is an issue. We need to protect these people. But let's go back. Let's finish it up on the nursing side. I'm pretty sure I'll do a podcast one day on the on the teacher and the military side of it for sure. But let's finish up on the nursing side, because in conclusion, the nursing shortage in the United States, exacerbated by stress and burnout, poses a significant challenge. However, through proactive measures and a committed focus on mental health of our nursing professionals, we can work towards a sustainable solution. It needs to happen. We don't have a choice, because I don't think I want to know what's going to happen if the shortage gets even worse. Let's not find out. With that said, my friends, if you want to learn how I manage my mental health on a daily basis, if you're looking for some tips and tricks on mental health that I personally use, that maybe you could steal for yourself, subscribe to the Vibe with Kai on Patreon. It's only $1 per month. You'll get all of that and so much more. That's $12 a year. That's it. With that said, my friends, thank you so much for listening. As always, much love, good vibes. I'll catch you later. Bye.